The Sauk County Public Health Department began preparing their COVID-19 response several weeks before the first case of the virus was confirmed in Sauk County. The focus throughout the pandemic has been to educate, collaborate with community partners to maximize beneficial impact. Successful collaboration resulted in free COVID-19 testing sites being offered throughout Sauk County each week. Sauk County public health staff have done what public health does for any communicable disease. That is, to provide information to educate the patient about the disease and ensure isolation to prevent further spread. On March 11, 2020, the World Health Organization declared COVID-19 a pandemic. On March 13, 2020, President Donald Trump declared COVID-19 a national emergency.
The federal government did this effort today. I am officially declaring a national emergency.
On March 18, 2020, the first COVID-19 case in Sauk County was confirmed. On April 11, 2022, Governor Tony Evers presented Sauk County Public Health Department with a commendation for their invaluable contributions to Sauk County and the state of Wisconsin. Jody, what was your job during the pandemic?
During the pandemic, my job, I was kind of a jack of all trades. It started out that when the pandemic first started, our job was to gather all the credible information that we could so that we could be a reliable source of health information for our county and our community residents. And so we would get all the information, glean all of that from the CDC, from DHS, and then we would translate that back into a form that applied directly to our residents. And after that, we worked to bring testing to our county. And during that, my job was to help set up the testing sites, figure out who was going to do the testing. It was really a team effort. We all worked together in various capacities because this was brand new to all of us. Nobody had encountered anything like COVID before, and certainly not a pandemic of this sort. And then we transitioned to vaccines. And vaccines were really, the thing that we'd been waiting for. That was what was going to kind of move us into the next step of moving past COVID, we hoped. And right around vaccines, my job switched to the incident commander. And in that role, I kind of guided and led us towards the future. What's coming down the pike towards us? What do we need to be ready for? And what are our next steps in addressing what the next variants or what's coming at us from COVID?
My current position is Disease Investigation Specialist. We're known as DIS. And in that role, as a Disease Investigation Specialist, I am one of multiple staff members who, when we have positive cases, would call and direct those positive COVID cases with guidance for isolation and quarantine instructions for themselves, their friends, and their family. I have actually had 3 roles. I started out doing the disease investigation and then rolled that into a grant with the ADRC, coordinating a COVID-19 vaccine transportation grant. And that was working with the ADRC clients, contacting them, and those age 18 and above with disabilities, and helping them get free transportation to our vaccine sites. And then also worked with homebound individuals who needed vaccines and helped them with local agencies get those vaccines in their homes. And then the last thing that I did was I coordinated the Circus World testing site in Baraboo, and did that with a solid core of volunteers who were the best volunteers you could possibly have.
Christine, how is the partnership with Sauk County Public Health Department important to either the outcome or the process?
The coordinating with our partners at Public Health and our local EMS providers was very important because it allowed us to give the most up-to-date and accurate information to the clients that we were working with. When we did our testing at Circus World, we worked very closely with the Baraboo Fire and EMS department, and they were amazing in allowing us to use their equipment for our testing site. We had partnerships with other entities throughout the community as well. Reedsburg EMS, I still test with them, and it was a real good fit and important work because it was necessary for our community members to know if they did, have COVID so that they could protect themselves.
I feel our partnerships throughout our whole county were extremely important. I was actually able to be kind of like a community convener throughout all this. For a while when COVID was our numbers were very high, we were having weekly or every 2-week meetings with, we'd pull our hospital administrators together. On another call, we would pull all of our school administrators together, and that was, as far as Baraboo, Sauk, that was also River Valley, Weston. We made sure to cover all of the schools, that even if they were only in our county a little, because some of them cover multiple counties. And also, like Christine had said, our EMS partners, we pulled all of them together to make sure that, first of all, everybody had up-to-date information, because at the heart of COVID, things were changing, if not daily, at least weekly. And so it was really important that everyone was on the same page and that we were able to, pass along the most up-to-date and helpful information we could, so that everybody was, kind of on that same page and working together towards that same goal. I'd like to think my job helped save lives, is what our leadership reminded us of a lot during this pandemic. It got hard because the COVID was heavy. There was a lot of hard things that we had to work through, and the one thing that our leadership kept telling us, kept reminding us, well, 2 things. First of all, was that it was not a sprint; it was a marathon. And so, especially when, we were getting 100+ cases a day, it was hard to watch, like, our nurses who would, just overthink everything, because they were like, these people all need our help and we can't physically get to them all. And so, leadership really helped us remember that, you can only do what you can do. And then the other thing I think that was important for us to remember was, our emergency manager was our incident commander for a while also, Jeff Jelinek. And anyone that's worked with him knows his top priority is life safety. And so he was constantly telling us, everybody, take a deep breath, take a step back, and, start with life safety. Again, you can only do what you can do. And so that really helped us to remember, that the most important thing here are, people's lives, and let's start with that. And so I think that was probably the most important thing, to kind of keep us on task and remember throughout the whole pandemic.
I think my job during the pandemic helped our community by providing them with accurate information. When we talked to them on the phone, we would let them know exactly, what our recommendations were to keep them safe. We gave them additional information on food insecurity that they may have while they were in isolation, because a lot of times if one person was in isolation, the rest of the family would be getting COVID, and so there was going to be a long time that they were needing to stay home. And so we gave them a lot more information than just the basic that you would think of as far as what to do now that you're sick. Things on where to get information if you can't pay your mortgage, that food insecurity that I had mentioned, things like that. We did many more things than just give them, the basic guidance for the isolation and quarantine. And then as far as the testing went, we actually we developed relationships with people during our time testing, because they would come back every week. And it was the same people they were seeing every week, and they'd be able to fill us in on, if a member of their family had gotten COVID, how they were doing. And the volunteers actually, they really cared. They recognized people from week to week and they'd ask how they were doing. We had people bring us cookies. We had people bring us coffee gift certificates. We had people bring us when we were outside and it was freezing out testing. They brought us hand warmers. So we did develop that relationship with our community when we were providing the service. Besides the fact of working with the volunteers at the Circus World test site, we developed friendships that we're going to have forever. I would say, and I think Jody was there that day too, it was probably the first time that I helped with a vaccine clinic and we were vaccinating children. There was a dad who brought his son in, and his son was so excited. He was, I don't know, he was on the lower range of the age he could be, and brought him in, and his dad had this, he puffed his chest out and he said he asked to come and have this done. And so we all watched him as he got his vaccine, and we all clapped and cheered for him afterwards. His dad was so proud, and the little boy, we asked him, why did you do this? And he said, because it was the right thing to do. And so that was one of the best moments. There have been lots of them, but that one surely sticks out in my mind.
Well, my best moment would kind of center around the same thing, vaccines, but throughout this whole pandemic, we were giving people all this guidance and, stay home and wear masks and quarantine and isolate. And the whole time we kept saying, okay, we're doing this because we're waiting for vaccines. It was known early on that, that was kind of the end result that we needed, to be able to have this vaccine available. And, so we were doing all this research while the vaccines were being made and, agreeing with, the scientists that, this was, developed in a safe way, and it was going to be really important that we get the word out there. And I still remember our very first vaccine clinic, and actually Jeff Jelinek, our emergency manager, was one of the first ones to get vaccinated. And, we took all these pictures, and there were people that, got teary, and it was a really moving moment because it was, like one of these things where finally, what we've been working for, what we've been telling people to, just hold on for, was finally here. And that was pretty exciting. And our first vaccine clinic, was packed, and it was a really good moment. I think finally because up until that moment, everything was, very, we were dealing with sick people. We were telling people to do things, that they weren't happy with, as far as isolating and quarantine and wearing masks. And it was just really heavy. And this was kind of all of a sudden, especially for the nurses, it was finally kind of a light at the end of the tunnel. We're doing something good. We've got something that we can tell people, will help them. So it was an extremely positive moment for all of us. Just remembering that public health is, every single person in our department is there to help people. We're not in it for the money, that's for sure. We're there because, we know that there are resources out there that we have access to that we can make people's lives better, not just as far as their health, but we look at housing situations, we look at food insecurity, we look at how neighborhoods are built. Do people have transportation? So just to remember that, throughout all of this, we have been there for our community, and our goal from day one has always been to keep the residents of our county as safe as possible.
We never were the bad guys. Like Jody had said, we are there because we truly are invested in making our communities a safe and healthy place. I was extremely pleased when I was hired to work with Sauk County because I knew that at some point vaccines would be coming down the pike. And I actually was part of the AstraZeneca trial over in Madison. And so I was invested that way as well. I wanted to be there when vaccines were made public, regardless if it was AstraZeneca or whatever. Wanted to be part of that. And public health gave me the opportunity to do just that. So it's been a great experience.
Your role during the pandemic.
I would just like to add that none of this, our successes none of them would have been possible without the incredible team at Public Health. I mean, we went through 3 different leaders from when COVID started, and each of them, brought their own special, guidance and leadership to us during those times. And the fact that all of our team members pulled together, every single one of us did many things completely different and out of our scope of our normal work. I still joke that I'm trying to get back to what I normally do, but I don't even think I know what that is anymore, because it's been so different for so long now that it's hard to get back to that. So everything was a team effort, and could not have been achieved without all of our team members pulling together and going over and above on what was expected of them.
And they're caring for staff, as Jody said. My boss in particular would check in with us every week, and she'd say, so how are things going? Let's do a one-on-one, and if we need to have a cry session, we will. And there were times when it got really, really tough, and we were talking to people who were really ill, or people who were in the hospital, or we heard that someone that we had spoken to had passed away. Our boss would say, remember to give yourself grace. We're all in this together. We're all learning as we go along. We're all taking care of each other. And every single person at Public Health has that attitude, and it's just been a fantastic experience considering what we've been dealing with.
I'm one of the public health nurses. So initially, at the start of the pandemic, my role was identifying and following up with those who did have COVID-19 disease and determining their contacts. I provided education regarding the disease and talked with their contacts to inform them of our isolation and quarantine recommendations. I also informed them of signs and symptoms that the contacts may have contracted the disease and the importance of testing to determine if they had COVID-19 or not. As the vaccine became available, my role transitioned to part of our public health team that organized and delivered the COVID-19 vaccines. I was also responsible for our storage and handling of those vaccines. My job helped the people of Sauk County in just being part of our public health team, which engaged and coordinated with other healthcare providers, businesses, and schools in the initial response to this pandemic, to ensure that all the measures were being taken, that we were coordinating our efforts, and that we were reaching those who had limited access to some of those resources. We all worked together to ensure that the residents of Sauk County received these services and were informed of what was happening during the pandemic. And I believe in keeping all of our community members and resources informed and working together, that we saved a lot of lives in Sauk County. It's important to me. I've been in public health for over 25 years and have always kind of been on the background doing a lot of the similar things that we did in the pandemic. It just focused all of our resources on the COVID-19 disease. So it was important to continue that public health effort and to be more visible. I believe in the past, most of our public health efforts have been kind of on the background. So it was important for us to take the knowledge that we had in all our years of practice and put it into practice, and to help people understand what was happening, to calm their fears in regards to what they needed to do to prevent getting COVID-19, if they did have it, how to protect those that were around them, and to allay some of their fears that they may have had in regards to the vaccine. There was a lot of rumors and misinformation out there initially on the vaccine, and so it was important for me to let people know what the science was behind the importance of the vaccine in controlling serious illness, hospitalization, and even death. I thought a lot about this question, and there was a lot of best moments that would happen just, really quickly and pass by. But thinking back, I think the overall best moment was seeing our public health team come together, step up to the plate, provide our knowledge, our experience in this, in helping people and to guide them through this pandemic. It helped to minimize the impact of the pandemic for our community. One other thing I want to mention is the National Guard was very instrumental in assisting us with this effort and helping us to do the COVID-19 testing and at our vaccination clinics. And on a personal note, it was really something to see this team, this National Guard team come in, all dressed up in their uniforms, carrying their supplies, with them a whole sense of duty around them. At times, it took my breath away. It made me feel proud of this country, and it really made me feel good that what I was doing was important and that it was supported. That public health is all around you, that we're working day to day in regards to these public health issues. This wasn't something that we suddenly started doing for the community, that we're always there. We're always on top of all the current information that's out there regarding public health and protection of the community in regards to communicable disease and vaccines and the importance. I'd also like them to know that we are a good resource for any questions or concerns that you have in regards to any of the public health issues. We're also one of the departments, people, services that will come out to you to provide these services. If you don't have access to, the healthcare stuff in regards to vaccines or water testing, so many different things, taking a look at your house to see if it has lead contamination, that we're the people to call for those services.
I never knew that.
There's a lot of things that public health do that people don't realize.
Okay, you look very prepared there. So I'm going to ask you this question. If you're prepared for it, fine. If you weren't, that's okay, because this is one that's kind of for like the ambulance people. How was the partnership with the Sauk County Public Health Department important to the outcome of the process?
Oh, I think that's what I mentioned earlier, and some of our efforts towards Sauk County. We, from the very beginning, were very dynamic and a leader in bringing together all those services, emergency services, healthcare providers, hospitals, our businesses. We had, sometimes it came to a point we were having daily calls with all of these groups. Hey, here's what we know now. This is our response to this. Hey, we're not able to provide this service. What have you got? What can you do? We can do this. Can you do that? It was an ever evolving process and coordination. And it was wonderful how everyone stepped up to the plate to say, hey, we've got the resources, we can take care of that, or no, we don't, what can you do? And so that coordination from the very beginning and communication of what was going on out there was so much communication. Things would change sometimes 2-3 times a day as to our direction and where we were going and what we were doing. It really helped to eliminate the chaos of the situation and for us to have a plan to move forward and what services needed to be provided.
Haley, what was your job during the pandemic?
It changed several times throughout the pandemic. Early on, it was kind of all hands on deck for all of our nurses. We hadn't hired any extra help yet, so there were 5 of us and 1 nurse retiring, so then there were 4 of us, and we were just trying to figure out what all of this was going to look like with the pandemic and what was going to be needed. Really early on, we were thinking that it was going to be going away soon. Clearly, we were wrong. We had to do contact tracing and disease investigation. We were calling workplaces, businesses were calling us. Our phones were ringing off the hook. We were working extra hours and weekends. There were really early on, we were even driving thermometers out to people's houses if they were close contacts. And we were just really whatever was needed at the time. It evolved several times throughout the pandemic. Eventually, we had a team of disease investigators hired. The number of disease investigators changed a few times throughout the pandemic, kind of based on the need and what we were seeing in the community. So as we got more disease investigators, the nurses, we all tried getting a little bit more back to our pre-pandemic jobs, and that really ebbed and flowed throughout the last couple of years. We worked on the disease investigation and contact tracing until the team of disease investigators was really up to speed and able to do most of that. And then I helped kind of lead that team a little bit, where I would kind of assign out cases for people to take and answer questions and do those kind of things until we had another nurse who was hired full-time, and she took over that role. And then about that time is when vaccines became available. So then our jobs all kind of changed again. We started doing vaccine clinics here at the county building, as well as several sites throughout the community. We would do mass clinics. We did some out at the landfill. So we really were just whatever was needed at the time. So it definitely evolved, and the need for all of our nurses to be doing strictly COVID work kind of ebbed and flowed as cases changed and as the needs changed over the last 2 years. I think we were really a resource, and we were whatever the community needed. And like I said, our need changed throughout the last 2 years. Early on, it was calling people, answering those questions. Then it became more vaccine related, where we realized that there was this need for mass vaccine clinics. And so we stepped up and we took on that role. And I think we were really whatever the community needed it when they needed it. We stepped up and really filled that role. I think my best moment during the pandemic was in January of 2020 when we had our first vaccine clinic. People were really getting burnt out at that point. We had been making phone calls for several months. We were telling people they had to stay home, telling people they couldn't go to their family gatherings. Kids were home from school. Parents were stressed. It was rough. And we opened the doors to that clinic that day. We had every slot filled. We couldn't administer anymore because we were using up all of our supply. People were lined up down the hallway, and there was this sense of hope that was awesome. We all just felt this hope, and people were excited to see us and excited to be there. And we felt like people, it was the first time that people were excited to see us or hear from us. And it was the first time we were seeing people. We had all been working from home in our own little bubbles. There were a few of us in the office at a time, but we really hadn't seen people. And so when we opened those doors and there were people and there was kind of excitement in their voices, it was relieving and hopeful, and we all just had this almost like a weight lifted off of our shoulders, like there was something positive happening for the first time in a long time, and you could really feel it when we had that first vaccine clinic. I think if we had to do it all over again, we'd really want the community to understand that public health wants what's best for the community. We want everyone to be healthy and happy and prosperous, and we're not here to just try making people stay home in quarantine. We want health of our whole community and health in every aspect of that word. You know, we want overall wellness and well-being, and that's really all that public health wants. I think it's been a long 2 years, but I think everyone is hopeful that things are looking up in the right direction. Life is getting a little bit back to a more normal. maybe never will be quite back to the way it was before the pandemic, because this was obviously life-changing for everyone. But I think we're all hopeful that things are looking up and we're definitely moving in the right direction.
Hired specifically to help with the COVID-19 pandemic. When that started, they, I think, came up with these roles, and the title was Disease Investigation Specialist. So it's to contact trace, speak with the community regarding testing, the results, all of that sort of stuff. But we were kind of thrown into it because we didn't know anything about it. Nobody really did. So we all kind of worked together to figure this out to help Sauk County and the community. When people think of the health department, they think like, oh, it's the government. They're not here to help, you know? But learning all this stuff that I learned, especially about COVID, and then it opened my eyes to like everything else that the health department does. So I think specifically what we learned and what we were trained on and what to do, just calling people and speaking with them regarding COVID, because that's all that we did really for the first 6 months or so, was call people on the phone every day, speak to them. How are you? And for the one bitter person that I got, there was 100 of these grateful people in our community that were so thankful that someone was reaching out to them, guiding them through what to do next, guidance, resources, all of that stuff. And we would give them our email, phone number, work email and phone number, so they could contact us back directly, so they wouldn't have to be calling like all these lines to get to the person they spoke to on the phone that one day. So I think that really opened their eyes too, like the health department really did help us through this time. Like I'd get calls back from them, specific people, for other things even, like, you know, do you have resources about this, resources about that?
This is the part where I'm going to go off script.
Okay.
Do you remember the phone call you made to me?
No.
You called me. I tested positive, and I couldn't have had COVID because I've been vaccinated. I'd been boosted. I didn't have a fever. I just had a cold. I couldn't have COVID until the day I lost my taste and smell. I didn't know that I was going to get a call from the public health department, but it was you on the other end. And I specifically remembered you because your name is not that common.
Right.
And one of the nice, reassuring things you had shared with me is, because I was vaccinated, the chances of me shedding the virus to my wife, which I was very concerned about, was pretty low. And I personally want to tell you, thank you, because it really reassured me that I was going to be okay and she was going to be okay. So, personally, thank you for that.
You're welcome.
And it was a very important phone call to get, because I had questions and I did not know where to go except Dr. Google. So thank you, Jana, for the phone call to me. And I personally know what you did. And I personally thank you and the Sauk County Health Department.
You're welcome.
Okay, let's go back with our script. Can you share with me your best moment during the pandemic?
I would have to say being chosen to be part of this equity grant to specifically reach out to the underserved community. I believe Spanish speaking is about 5% in our Sauk County community. So me being one of the only hired workers for the county or the health department that speaks Spanish, able to translate, that was a big thing that I felt was a big attribution for them. And we did vaccine clinics. We did outreach programs. We did the commercial that I was in. I had 3 billboards in Sauk County with my face plastered on them in Spanish. And I just think that was like the best, like one of the best things that I think I could have been a part of to help reach the underserved population, especially those Spanish speaking. That's also what I really enjoyed too about working during this pandemic. Just to be kind, I think, and understanding. There's so much that goes on besides COVID. And some people, like our main goal was to educate the community so that they could make the best decision for themselves. We weren't like, you have to do this, you have to, it's recommended, it's guidance, it's education. So that, like I said, you can make the best decision for yourself, for your family, for those that you're in contact with. And a lot of people were just rude and not nice and made you I feel like the bad experiences stick with you more than all the good ones. So I think that's one of the pieces of information I'd want people to know is just be nice, be kind, and educate yourself if you want to make the best choices for yourself and for your community and those that you love. And it was definitely an experience.
During the pandemic, my job changed quite often. I learned to be very flexible and to step into whatever role necessary. At the beginning of the pandemic, my phone blew up overnight. So when I would come in at 8 o'clock in the morning until I left at 4:30 in the evening, the phone did not stop ringing. I had 5 lines, and all 5 lines were full at the same time. So it was a challenge. I was finding in the weeks and the months to come that I would need to come in 15 or 20 minutes early just to field the voicemails that were left in the voicemail system the night before. So, and then I would make sure that those were dispersed and be ready at 8 o'clock in the morning to go and do it all over again. We learned that the nurses took on new roles. So they had to step into contact tracing and had to do other responsibilities, which meant that I didn't have the people I normally would have to go to the calls with. So I was having to pick up calls that I normally would not field. With the help of Jody Molitor and our nurses, they put together talking points for me and verbiage that was very easy to follow and very easy to give out to the public. So I could field about 90% of most of the calls that I got. The other 10%, I did need to find a nurse or make sure that they were talking to somebody that could help them answer the more difficult questions. It was at that time that I found out that my job took on a more complex role. The questions were not easy. The people were very upset. We had people that were just afraid. They were scared. They were afraid. Many of the older population were just isolated and alone. So those were the ones that I really took more time with, just to say, it's going to be okay. That's what we do. That's what we're here for. If you feel you need to call back in, by all means, call us. And just being honest with them. Once our calls started to continue to come in, they did set up a phone tree for me. And so that dispersed calls to other people. We hired contact tracers, so that alleviated some of the time for our nurses. So I was able to go back to the nurses with many of the calls that I needed to handle. And then my role took on another role, not only answering the phones, but helping with the vaccination COVID clinics. So when we were doing them on the 3rd floor, I would try and figure out what the flow should be to make sure that we were trying to maintain the 6 feet distance and to make sure that everybody got where they needed to go. I then made sure that they got checked in and that the information, all of the paperwork needed to be filled out. They were consents. So we made sure that we went over all of that. And then I had to check each person in on the Wisconsin Immunization Registry to make sure we had the spelling of the names right, the date of births correct. If they weren't from Wisconsin, we had to do it all completely different because they had to be set up in the system. So each individual was a little bit different. People wanted to ask questions about each individual vaccine too. You know, they weren't sure what they wanted. So you could give and offer the information, but it was up to each individual what they felt would work best for them. So lots of questions, lots of hand holding, just being there for the people and making sure they felt safe and comfortable. So the COVID clinics, like I said, were a big part of what I did as well. And then after the clinics, I had to put in each and every one of those consents into the system. So they had to be scanned to make sure we can go back and make sure that they did get what they asked to get and everything was filled out properly. Other than that, it was just day to day, everything changed. You know, the calls I took were, some people were very, very angry. Some people, like I said, were alone and afraid. It just, every day was something different. So really that was the majority. And then to try and keep up with the day-to-day responsibilities that we always need to do. Our staff is amazing. Our nurses are great. And we just want the community to know that whatever we do, we're trying to do for them. I think one of the best moments for me was at the COVID clinics. We had a lady who, she came in the first time, filled out all the paperwork, and we put her in the room, got her all ready for her vaccine, and she's terrified of needles. So she couldn't do it. And she left, and we were like, it's okay, just come in when you feel comfortable. So a few weeks later, she came back to us, filled out the paperwork. We got her all set in the room, and she came into the room and she said again, I just can't do it. And I just felt so bad for that lady. And then she came back for the third time, and I gave her the paperwork. She was filling it out, and I stepped in the back, and I went to one of my nurses, Barb, who has been doing this for a really long time, and she's so good at what she does. And I've seen her with the littlest of people and older people, and she just has a way of putting them at ease. And she was able to give this lady her vaccination, and the lady came out and she was so excited. She was so thrilled that we were able to get it done, and it was just a good feeling to know that you were part of that process. I think my job helped people in Sauk County just by being there to listen. You know, that I've been doing customer service for years, and over the years, you just build things. You build, you know, how people are feeling. Even over the phone, I can get a sense for how people feel. In person, it's obviously a lot more easy because you can read them by the way they hold themselves. So just being able to take them through a conversation, let them know we're here for them, let them know what their options are, and then at the end, you can almost literally feel it in their voice, that they feel like you answered their questions. You were there for them. And if I can even hear or see that smile on their face and know that they left our office a little lighter and breathing a little easier, then I feel like we accomplished a lot. What I would like to add is I would just like to really thank everybody that I work with. We have an amazing staff, all the way from the administration up to our officer. Our nurses are amazing. Our people who put together all of the packets and information. Our team we work well together, and I'm proud to be part of that team. And to thank the community for trying to be patient in a time that was very, very difficult. And I hope that moving forward, we can learn to work together and continue to do good things. I just would like the community to know to try and be a little more patient. We're doing the best we can in a difficult time. We know that today's society they want an answer immediately. We don't always have the answers immediately. Sometimes we have to wait for information to be released to us or to get the approval process. So please be patient. And for you that are younger, that have the capabilities of the iPhones, the computers, please let your fingers do the walking. We have a Facebook page. We have the Sauk County website. We update things on a regular basis. At the height of it, we were updating on a daily basis. I think we continue to do that. So it is all there. Please try and keep those lines available for the older generation who doesn't have the iPhones or the computers. They are just a part of the community that's kind of lost in some of this, and they just need somebody to listen and be there for them. So just please be patient with us.
Siobhan, what was your job during the pandemic?
During the pandemic, I was responsible for data and informatics. So what that looked like was I was the person that was running the reports to get our current case counts, to run reports out of the Wisconsin Electronic Disease Surveillance System. I was the one that worked with the hospitals and ran hospital data. So all of those different data and reports, and put all of that up on our Sauk County COVID-19 data hub. And at the beginning of the pandemic, the state didn't have a lot of county level reports. So most of the reports that were made had to be made at a local level. So it's us manually running custom reports and sharing that information. So in the beginning stages, it was a lot of manual reports and running and having to dust off my college statistics book and, using a lot of that information that I had learned that way to provide the data and the current guidance so that our residents had the information that they needed to make the decisions to protect their own health. So that was a big part of my job. And then also I worked with the GIS staff to create the testing site locator. So that map where if you felt sick or if you were exposed and you would pull up that county level map to find a testing site, that I would keep updated. And so creating that map so that you could find that, and then later the vaccine site locator map as well. When the pandemic first started, people had a lot of questions. This is a new novel virus. Things were changing very quick. And we tried really hard to update our Sauk County website, update our data hub with the most current and up-to-date information that we had so that people had accurate information to go off of. And so I think helping and providing that information in a way that was more accessible was really helpful. And then the testing site locator map, that was one of the most widely used and accessed websites that we had. And then later that vaccine site locator map, since we got a lot of questions about where can I get a vaccine? And so that was available to help people so that they could take advantage of the different tools that were available during the pandemic to protect their health and to protect everyone else around them. I also participated in lots of meetings. So in addition to the public-facing data dashboards and things like that, the health department met a lot with lots of different stakeholders. So hospital staff, fire and EMS. We met with faith leaders, with schools, with business owners in different kinds of meetings to answer questions, to provide data, to assist them in any way that we could with different information so that they could make the best decisions for their organizations. And so I think that really helped as well to be that resource. So we collaborated with a lot of different people. We have a great team here at Public Health, and there are lots of wins that really required the cooperation of lots of people, but very specifically to my role, the biggest win that sticks out was late in 2020, staff from Wisconsin DHS reached out and they asked if they could share from our COVID-19 data hub and specifically how we use some syndromic surveillance data and shared it with the public and with different organizations. They asked if they could share that with the CDC. So for me, being recognized that work at the state level and then knowing that the work that I had done was being shared with the CDC, that was kind of exciting. This work through the pandemic was important and continues to be important because I live here in Sauk County. I raised my family here in Sauk County. My kids go to school in Sauk County. And so it's really important to me to help other Sauk County residents to have the information and the resources so that they can be healthy. Because when we have healthier people in our community, we're going to have a healthier community. If there was one thing that I wish that the community would know, and there were plenty that did know this, But to remember that your public health staff are people. We are people that live here. We're your neighbors. We're people that work here because we care about the health of our community. And so remembering that we're people.
My name is Jeff Jelnick. I'm the Emergency Management Director for Sauk County. Really at the beginning, it helped with establishing the command and control and really getting the Emergency Operations Center up and running. We also worked with the logistical component of PPE, personal protection equipment, and that was really kind of the focus until when the health officer resigned. I was asked then to run the COVID response for the health department. So I was the incident commander for approximately 5 months with the health department and running COVID response. Well, I think the biggest thing was getting information out to individuals. And I think the other thing is just what helped was the staff that we have working in Sauk County. The health department staff are amazing. They truly did care. To see the dedication and the time and effort that was put in. This was not a Monday through Friday 8 to 4 operation. They were there when they needed to be there all the time. No matter when we called them, they were up and ready for the challenge. And I think really that helped the county by just the dedicated individuals we have in the health department. The best moment during a pandemic. You know, this might not seem like a big one, but when we had the isolation order, I guess there's really two that are sticking in my head. When we had the isolation order on Hiawatha, and we had to provide 3 meals a day to the individuals, the J1 students that were in there, that went on for approximately like 18 days. The people that stepped up to help, the businesses that were in the Lake Delton and Wisconsin Dells area that provided food, we paid for some of it, but a lot of it was at a reduced rate. And then the Lake Delton Fire Department, Chief Darren Jorgensen and the team, that on the weekends to give us a little time away, would go and deliver the meals and help us out with that type of thing. That's one of the big things that sticks out. The other one is the first day that we did vaccinations in January, the first day of public vaccinations. I can remember being downstairs here in B24 and B30, and you could just feel the electricity. You could feel the staff finally feeling that we were getting someplace, that we were finally doing something, because before that, it was just constantly changing things. Things were changing so quickly and trying to put out fires here and there. And that day was an unbelievable day. And I get goosebumps thinking about it because I can remember going home that night, about 8 o'clock at night, and just typing email to all the staff and just stating that what a great day, what energy, and that all happened because of the dedication of the men and women of that Sauk County Health Department. Yeah, I was the first one to get a shot, but that was the reason because a lot of the nurses up there have, over the years, I've been here quite a long time, had an opportunity to finally put a little pain in me. I think the biggest thing would be a little bit better communication to the public, especially at the beginning. With a flood, with a fire, all these different things, we truly know what's going to happen. But in a pandemic, things were changing so quickly. And I think the biggest thing was to get out more information of why things were changing and to let them know that in the health department, they were not trying to do this to be mean. They were just putting out the best information we had at the time. We give you the information as the public, and then they make a determination. So I think a little better communication with the public. We ended up doing that once I took over as incident commander, and we started doing nightly conference calls where people could call in, and we had topics and things like that. But I wish we would have just did that a little bit sooner. No, I would just say the biggest thing that I've taken out of this experience, and I knew this from a peripheral standpoint, but once you really get into the weeds and into all the ongoings of our health department staff, I mean, truly, the Sauk County Health Department, the men and women up there, even though some of them normal day-to-day job is not pandemic related, everybody was involved, and they are truly champions. They did an awesome job. The stress, the things that they all had to go through, they're not used to dealing with that type of stress, and they're not used to people yelling at them and swearing at them and cussing at them, and trying and to deal with that when you're not used to that. And they kept showing up. They kept showing up every day, and they just kept the drive. And my hats are off to the folks in the Sauk County Health Department, Public Health Department.
My job during the pandemic was Operations Section Chief. Well, I think the COVID work is very important to us as a public health department because, helping everybody live their most healthy life, whatever that means for them, is at the backbone of everything that we do, and COVID fits right into that, not only from that standpoint, but from a public safety standpoint. And I think helping to keep our residents up to date on what was going on, it was rapidly changing in the beginning, was very important, but also having access for clients to get tested, to get information, to get a vaccine was very important. And I think that we did a pretty good job of trying to get into all the areas that we knew needed testing, vaccines, and information. I can't pin one best moment per se, but yet a collection of moments that were basically us working together with area agencies and partners, internally and externally. I think that was the best thing that came out of this work, was strengthening relationships that we already had with area partners, and making some new ones as well. So I think that was the best part of the entire experience, was those relationships. I would like to add that one of the things I am most proud of here internally is that, other than one retirement that occurred early in the pandemic, we have the same team. I have the same group of public health nurses that I did when the pandemic began. And I think that's pretty cool.
Within the county and also assist outside the county. So our job was to assist public health with the pandemic. Working for the county, our job is always to assist the public and our residents with any of their needs, whether it be the testing sites, the vaccination sites, assistance with housing, food, hotels, anything to do when incidents like this happen. So with COVID, a lot of it was testing and vaccination sites, as well as making sure we had enough PPE for the hospitals, our businesses, our schools, and anything else they needed. When we actually started getting some vaccines available for our residents, I think seeing the joy on the residents of the county, knowing that we finally had some to give out, would be probably that moment. Seeing them a hope that this was coming to somewhat of an end for some of them to get that vaccination.
First thing that we did is started with COVID testing. So we ran a drive-through COVID testing site right at Reedsburg Ambulance, and we actually continue that through today, and we're going to continue it through at least mid-2022. The second thing we did is, when the COVID vaccine became available, we recognized a need for that COVID vaccine in the community, and it was hard to get when it first came out. So we offered a drive-through clinic so that people could drive through and get the COVID vaccine also. We've had a lot of appreciation from the public as far as offering that COVID vaccine and the COVID testing. It offered opportunity in the northwest part of the county for people to get the COVID tests. It was difficult to find places that you could get COVID tests initially, and it really was a place that was close that people could come to and get that testing done. And then when we did the vaccine, it was, we had just a ton of appreciation from the community that they were able to drive through. They didn't need to get out of their car. They could stay right in their vehicle. They had minimal contact with other people and could get the vaccine right there behind our building. As a mission of Reedsburg Ambulance, our goal is to provide the best possible care to the Reedsburg area, the greater Reedsburg area. And through this pandemic, it was really important to us to do everything that we could to support the public and, to fill our mission statement. So by being able to do COVID testing and COVID vaccines, it filled our mission statement. And because it was important to the public, it was important to us too. There was one couple that had not been out of their house in over a year. And this was the first time they came out so that they could come and get their vaccine. And they drove, and they were so happy that they could stay in their vehicle. And, it really gives you a good feeling when you're able to do things that help the community, that help the people that maybe weren't able to get out of their house, or they weren't sure where to go or what to do, and we were able to really provide that care and that accessibility that maybe wasn't available to them. I think the one thing that really would have made our job easier is just to remember that everybody's doing everything that they can do. There would be times that if we weren't COVID testing, a day that we weren't COVID testing and people were frustrated with us, or I really think that just to be humble and kind really is what it comes down to. That everybody is doing everything that they can do. Everybody was stretched thin in healthcare, continue to be stretched thin in healthcare, and just to be kind to the people who are working in healthcare, because really and truly, if you're still working in healthcare, you're probably still doing everything that you can do to make things better for those who are seeking healthcare. So we had a great partnership with Sauk County Health Department, and still do. They, being a small healthcare entity, we actually look to Sauk County Public Health to provide us with information, the most up-to-date information. And then when we went through started testing, Sauk County Public Health was actually who we tested through. So they provided us with volunteers and assistance during the whole testing process, and continue to provide us with that assistance. So, Sauk County Public Health was definitely a champion during this pandemic, and really did help us through the testing process. And then once we started doing vaccines, again, we worked closely with them. There was times that our paramedics would go out and assist them in homes to give vaccines. So it's really been a great partnership throughout the pandemic, and they've just been really great to work with, and provide us with the support that we needed to continue to provide the care that we did.